The American Diabetes Association's 2026 Standards of Care just dropped, and we are so honored to have Dr. Robert Gabbay, or as we call him, Dr. Bob here. He is the former Chief Medical Officer for the ADA, who is here to talk about all the key points in the new ADA guidelines, what you need to know. Excited to have our Chief Medical Officer for the Global PAD Association, Dr. Michael Dansinger with diabetesreversalpartners.com here as my co-host for the day. Dr. Dansinger, it's always exciting when we see new guidelines with all the updated information that we need to know to help improve the outcomes of patients across the US. Always excited to see them come across.
Absolutely. We're so fortunate to have Dr. Gabbay today here, Dr. Bob with us today. I'm especially
Yeah.
excited, and we're all so passionate about keeping up to date with the state of the art of diabetes care, and especially prevention and helping PAD patients to feel up to date and get the best possible care. And so the guidelines, I know you're passionate about making sure that the American public and healthcare professionals are aware of what's cutting edge. So, what are you most passionate about in the changes and updates to the new guidelines this year?
Wow. Well, there's a lot. I mean, it's a 300 plus page document, just to give you a sense for those
Oh
that
my goodness. And you've gone
don't
through
know.
every page.
I, not every page, but I think I got the highlights. Um, it's put together by dozens of
Yeah.
experts in the field that have really looked at all of the evidence from last year to this year. So I think there are a lot of things. I would say for this audience in particular, um, first, I'd say one of the recommendations that really has not been adopted as much is the importance of screening for peripheral arterial disease. Uh, we're
Oh,
not really
really?
catching people early, and as a result, they end up, in very unfortunate situations, potentially leading to amputation. So, catching them early, and the
Yeah.
recommendations are if you are over 65 with type 2 diabetes, that's already a reason to be screened. Otherwise, you have any other cardiovascular disease, screen for PAD. Um, and if you have various foot problems related to neuropathy and diabetes, again, should be screened.
That's actually in the guidelines.
Yes.
Oh, that is incredibly exciting. I know the ADA, we have one of my board members, you know very well, Dr. David Alper, who's right now on Capitol Hill with the ADA. And I'm sure they're talking about the guidelines, the importance of a foot check. But you know what's interesting is I just saw him this weekend at a conference in El Paso at the Limb Saver Society. And when he gave his presentation, he said, I don't understand how the insurance company can carte blanche actually approve an amputation and not approve a simple diabetic foot check. How is that possible in 2025?
Yeah, it's not a good thing. I think in particular, one, there should be covering for the screening processes, and as you said, Kim, that's been legislation that has been put forward, year after year to try to get that sort of mandated, so to speak. Um, I think there's a real opportunity for prevention. The other thing that is important, and I know that you speak to your viewers all the time about this, is don't get an amputation without a second opinion. Because so many times the limbs can be saved. Sometimes it's an emergency and there is no time
Very
for
true.
that. But that's rare. That's rare. Most of the time there is time, and you can get a second opinion. And many times you may not need the amputation.
The ADA actually reports that more than 85% of all diabetic and PAD related amputations are unnecessary. So what you're saying is it just rings true. Do not get an amputation until you get a second opinion, until you actually get a proper vascular evaluation, and particularly for diabetics, you need to make sure that you do have a doctor that not only believes in but will treat the small vessels below the knee and into the foot. There are all kinds of new technologies that are available, including a deep vein arterialization, where they hijack the vein in the calf and reroute blood flow into the foot. If you have a wound on your foot that's not healing and it is vascular related, make sure you do find one of these limb salvage specialists. So, can I ask you, was it in the guidelines prior to this to make sure to get, you know, tested for PAD, or is this something new this year, or is it something emphasized a little bit greater this year?
I think it's the latter. It's been in there, but again, it's a huge document. There's so much in there. It's important to emphasize that because that
Okay.
really is, from what I see, it's really not been embraced to the degree that it could be. And the screening is simple. An ankle brachial index is just a blood pressure measurement, the
Yeah.
ankle and the arm, and to see the difference there. That's enough to tell you somebody has really high risk of having PAD.
But if you have
Absolutely.
the symptoms, an ultrasound, if the ABI comes up with a potential false normal, is also important.
Yes,
Go ahead, Dr. D.
yes.
Yeah, so this is all about prevention, and I'm
Yep.
concerned that our healthcare system has not been as proactive as it needs to be with prevention. And in terms of, if the country is the patient, I would love to hear your thoughts, Dr. Bob, about what we can do as a healthcare system to do a better job in the grand scheme of things for helping
Right.
patients with diabetes to minimize their personal risk of PAD.
Well, I think there are a lot of things that could be done. The sad thing is that uh, we know a lot of things that work, and the challenge is people are not receiving the proper early diagnosis and then treatment. And so some of that is coverage, some of that is just frankly access to the specialists. I think solving that problem would go a long way uh, to reducing the challenges that people can have living with diabetes.
What about the recommendations in the new 2026 ADA standards of care for GLP-1 and GLP-1, GI, is it GLP drugs?
Okay.
I know that they're looking at expanding therapeutic roles, and I know since the last guidelines that you had Dr. Mark Banaka and his team come out with new, a study that shows that these GLP-1s, particularly Wegovy and Ozempic, can actually improve walking distance for patients with diabetes and PAD.
Yeah, and I think that's an important thing to follow up on. There is evidence; it's not FDA approved for that indication yet, but it's been real time. It's a very good, sound study. I think in the New England Journal of Medicine, very prestigious journal. So I think there's a real role for GLP-1s in individuals living with obesity that have PAD.
I saw that there's some updated recommendations related to GLP-1s. I'd love to hear more about your thoughts on that, and also about how um, we can use intensive lifestyle coaching to really gain the full benefits of the GLP-1s. I think we're shortchanging ourselves by failing to pair GLP-1 use with intensive lifestyle coaching.
We first of all, the recommendations talk a lot about the value of GLP-1 like medications for people with cardiovascular disease more broadly, and for people with kidney disease and people with liver disease. Uh, those have really been well established through studies to benefit there. I think the other point you make is an important one, is that uh, the solution is not either or, it's both together. And so we know that lifestyle is beneficial. beneficial in so many different ways. And one of the things I counsel my patients a lot because they, early on they start these medications, they tend to lose weight, and they have a little bit of a reaction of, oh, I can eat anything now because it doesn't matter. I'm not going to gain weight. But no, that's not true because we know that unhealthy diets, for example, um, are harmful for you in a variety of ways, even if you've managed to lose weight on these medications. And, if there was a medicine that would be one of the most effective medicines if it was a pill, it's exercise. I mean, exercise just improves so many different things. And so it's important, yes, if you're on a medication like a GLP-1, you'll lose weight, you'll get a lot of the benefits, but also to think about what you're eating and also the importance of exercise.
So digital health platforms really took center stage for the first time this year with the ADA 2026 ADA standards of care guidelines. And it really speaks to what Dr. Dansinger was asking you about with prevention and also the self-management support. Can you talk about some of those guidelines and what you're most excited about there?
The recognition that now, with these digital health approaches, you can really help people benefit in a variety of ways to help guide them on the healthy behaviors that will work. The right now, people tend to see their, clinician. Uh, they get some recommendations, and then they show up again a month, 2 months, 3 months later. Nothing really happens in between, and these platforms can be really a wonderful way to guide and support people day to day in ensuring that they're um, living a healthier lifestyle with you know little prompts, information, things that you need at the moment, as opposed to a handout you might have gotten from your doctor 2 months ago.
And I know,
Absolutely.
go ahead.
Dr. Bob, the guidelines have much to say about continuous glucose monitors. And can
Yeah,
you
yeah.
share some of the latest thinking about increasing the utilization and access to those?
Yeah, I think access is really an important issue. At this point, the recommendation is, first of all, anybody on insulin really should be offered a continuous glucose monitor because they're just so helpful. And you saw in this year's guidelines that there are individuals that will benefit even not on insulin because, again, that information of um, what you do, what you eat, the foods that you choose, and the impact on your blood glucose can be very helpful in guiding people towards a healthier lifestyle.
I'm curious if there's any, and I know this is a little bit out of the blue, but it's aligned that I would think, and I think Dr. Bob, you and I kind of talked about this a little bit before in a previous interview about integrating these continuous glucose monitors into health education in school. And it would be great if there was a grant that we could get and do some sort of study to see the impact that we could have with this integration and have the kids for a week or 2 weeks mark everything down and have the discussion about it. I see Dr. Danziger is nodding his head. You like that idea too?
Absolutely.
I think the power of the information you receive, that one receives from a continuous
Yeah.
glucose monitor, can be so helpful. I've used it. I don't have diabetes, but I've learned all sorts of different things. That you think some things are going to be not great for you, but some things that you think are actually okay, they're
Mm.
worse than you think. And some things that you think are really bad, well, you couple eating something with a walk, and you really are able to flatten out the effect of it.
And, one of the things that I noticed when I was using it, because Dr. Danziger always talks to us about the order in which you eat things. And so eating the protein before you have the carb and that kind of thing can really make a difference. Having a salad before your meal. I've noticed that that really has made a difference when I've been monitoring, with my A1C. I mean, I'm don't have diabetes either, but it type 2 does run in my family. And as you age, I just hit 50. You were more susceptible to it, right?
Indeed, right. And so having that information, the other great thing about people wearing a CGM is it allows them to really get that personal information. So it's
Yeah.
one thing to give general recommendations, but everybody learns what what happens in their body, which is sometimes a little different. And for some people, the order of eating, the types of foods, how much activity, all of that can really play into the impact on their health. And having that information, learn.
I'm
Yeah.
curious about the automated insulin delivery or the AIDs. There were strong recommendations in this year's guidelines, not only to offer it to anyone with, you know, type 1, but also type 2. I'm curious what the guidelines actually state on that, but I'd also, after you share exactly what the new guidelines are, I'd like to hear Dr. Danzinger's perspective on it as well.
The guidelines have become a sort of even stronger about the use of the automated insulin delivery, and that's because of the evidence that has been generated using it. So really, anyone with type 1 diabetes should be offered it.
Yeah.
But what's new is that individuals with type 2 diabetes that are taking multiple doses of insulin a day, which is really a significant, we're talking several million people, uh, they should also be offered an automated insulin delivery. And there are some that are approved specifically for people with type 2 diabetes now.
And Dr. Danzinger, what are your thoughts?
Yeah, absolutely. Have Is it your feeling that endocrinologists will embrace this new recommendation wholeheartedly, or might have some mixed feelings about moving into more um, insulin pumps in patients with type 2?
I hope that they'll grab a hold of this, and many already have. Having FDA approval also helps, but to your point, there's an educational effort needed. The other
Yeah.
thing I think the missed opportunity is these devices are getting simpler and simpler, and what I'd really like to see is primary care clinicians using it, because the bulk of people with type 2 diabetes are cared for by those clinicians.
And there was also some guidelines in regards to behavioral health screening. Can you talk a little bit about how that applies for folks with diabetes and what that means?
Turns out that people with diabetes are at much higher risk for a variety of mental health issues. Depression, in particular, about
Interesting.
30% people with type 2 have depression. So there's been a long-standing recommendation that everybody should be screened for depression on a yearly basis. Uh, what's new is screening yearly for anxiety symptoms, which are uh, all the more common these days. Um, and fear of hypoglycemia in individuals that have had hypoglycemia, because that fear can translate to not really wanting to sort of do some of the things that could be helpful, taking the appropriate amount of insulin and that kind of thing. And then the last thing to screen regularly for something called diabetes distress. Um, it can be very distressful to have diabetes and cause anxiety, but just this I don't know how to describe it better than distress. Uh, uh, there are approaches that can be helpful, but we can only use those approaches if we know somebody has this. And so there are screening tools that you can use to screen for diabetes distress.
I see a lot
And
of
it,
patients in my telehealth practice Yeah, and we spend a lot of time dealing with that. And so, speaking of intensive lifestyle counseling, can you remind us about the ADA's stance on intensive lifestyle coaching, such as weekly sessions with a qualified person? And has that changed at all? And where do you see that going in the years ahead?
I'm glad you brought that up because it this year's recommendations, it's an even stronger emphasis on that, and specifically calling out uh, more frequent interactions. In the past, it said, you know, lifestyle interventions are clearly important. Intensive lifestyle interventions are better, but they made a point of highlighting uh, uh, the regular engagement and the frequency of engagement, and part of the reason for that, just I wasn't in the room when it happened, but I've been in the room in the past because I sort of oversaw these guidelines with my role at the American Diabetes Association. Um, Another target group for these recommendations are payers. And payers often respond to what's been in the standards of care. And there are many examples of that where something appeared in the standards of care and then payers covered it. So this call out for the weekly and regular engagements, the hope is that they'll be better reimbursed as well.
Yeah, they really need these programs. And they would, Dr. Dansinger and I just had a joint patient that I think Diana's case would exemplify the importance of weekly coaching, what happens when it stops, and how you have to just, with some of these patients, you need to keep going, right, Dr. D?
Absolutely. I found that for most patients, the typical amount of support provided in medical offices every 3 months, for example, is nowhere near the optimal dose, which is probably once or every 1 to 2 weeks for the majority of patients. And we've all seen when patients are able to just have a weekly check-in, even a brief one, it can make all the difference between a high versus a low adherence rate to lifestyle.
Yeah. And, even weekly for what, 3 months. And then I think there needs to be regular check ins. You can't just leave someone. It has to be what it is. And we do need to prioritize the reimbursement system for those people that are willing to show up. And I think that's the key point. If they're willing to show up, reimburse it, meet them where they are, help them to be the best partners in their care. And, a lot of us do need that little extra accountability, right?
For sure. And it's been shown to be more effective. It's not just that we think
Yes.
that should be the case. It actually is the
Right.
case.
I believe the ADA recommendations are 16 sessions in 6 months, and to continue that for long-term maintenance.
I think that's so important. And one more thing, I know we only have a few more minutes left. One of the other areas that I want you to touch on is the clear algorithms for heart failure and ASCVD. Think that's important in the new guidelines.
Yes, so heart failure, again, one of these things that appeared a year or two ago in the guidelines, but did not get uptake as much, is the importance of screening for heart failure and catching people earlier uh, before they have symptoms, because we now know that SGLT2 inhibitors and GLP-1 agents can be helpful in the early stage before symptoms happen, what's called stage B heart failure. So that's one piece. And then the second piece is when someone has symptomatic heart failure, there's the recommendations on the use of SGLT2 inhibitors and GLP-1 agents to help prevent hospitalizations and sort of the challenges that can come with heart failure.
And so, final thoughts from both of you in regards to the takeaways. So, patients that are tuning in, they have diabetes, they have PAD. What do you want them to walk away with here?
I'll add one more thing, and this was new
Okay.
in the recommendations as well. and that's the importance of blood pressure. And the
Oh, yes.
recommendations here were to, if possible, and it's not always possible, right? But if possible, getting blood pressure down below 120, not 130, but 120 for
Wow.
people, for example, with PAD, and that's an important thing that you know your viewers can check their blood pressure at home and at their next visit say, hey, here's where my blood pressure is. I want to see if I can get lower.
Oh, that would be incredible. You know, the new Apple phones, iPhones, actually have the ability. My dad just downloaded an app for it because his phone can actually measure his blood pressure. I don't know how accurate, I haven't looked it up, but I thought that was interesting to democratize access to and making it easier to test, for blood pressure. I was over in El Centro, California with Dr. Athar Ansari recently with my dad, and he had the white coat syndrome along with a couple big cups of coffee before he went for the consult. So his blood pressure was a little through the roof. And the doctor said there's something new that he's working on, which I didn't even know about, is that you have a 24-hour continuous blood pressure monitor that you can get, which may be really helpful because there are fluctuations even in your sleep that are really important. Can you talk about that?
I think that's another underutilized resource because your blood pressure does fluctuate.
Yeah.
You ask me a tough question, blood pressure may rise. Uh, so yeah, getting a continuous measurement is
Oh
really
no.
the best way to know where you're at. And it's notorious that people show up to see their doctor and their blood pressure is higher.
And, with high blood pressure causes your A1C to spike. It causes inflammation in your arteries, and it also puts patients at higher risk of an aortic aneurysm. So it's really, you can't let you just say, oh, yeah, my blood pressure was high today. No, your blood pressure is high today. That is something you really need to talk to your doctor about and something that you do need to monitor because it can have some serious health implications. And I'm really glad that the ADA guidelines have some improved, you know, guidelines have guides, improved guides, for that lower that threshold for patients because it'll make them safer and healthier, I think, in the long run.
My parting
Dr.
thought,
Dansinger.
my parting thought is that the ADA guidelines just keep getting stronger and stronger each year as we learn more and more about diabetes and optimal management. They'll be even better next year for 2027. And the bottom line comes to making sure that we're using state of the art lifestyle coaching, state of the art nutrition, state of the art technology for glucose monitoring, and state of the art medication algorithms.
And is there anything, Dr. Gabbay, that you were disappointed that wasn't in this one, but you are going to double down to make sure they're in those 2027 guidelines?
It's a good
I'm
one.
putting you on the
No,
spot.
nothing,
There goes that
nothing
blood
that, nothing
pressure.
that comes to mind. Yeah, nothing that comes to mind. But as I said, I haven't read all 300 some odd pages, so there may be something along the way. Which actually is a good point because there is a mechanism that people can submit what they want to be considered in the next set of guidelines. There's an online form that people can complete and make
Oh.
recommendations that they think are important, and that's looked at by the committee seriously.
And if you want to go to diabetes.org. I think that's the website, and I'm sure you can navigate from there. We're very blessed to be on the American Diabetes Association's website as a resource for people with PAD. So you can definitely go to diabetes.org. It'll navigate to us as well. And we get a lot of patients that come from there, and we help them to navigate their PAD journey as well. But I am so excited that the ADA guidelines are for 2026 are really emphasizing the importance of early testing. I appreciate the work the ADA is doing on Capitol Hill to educate our lawmakers and to try and push for the ARC Act, which ultimately would democratize access for testing for all patients that have high risk factors such as diabetes. So really, really important. Thank you so much for joining us. If you do get through the next 100 to 200 pages of that, we would love to have you back on. I think we do have a question that just came in from our audience. If you have 2 seconds, from YouTube, how would you treat or recommend treatment for a type 1 diabetic with a severe edema, CKD, and CHD? So looks like chronic kidney disease and heart disease, possibly heart
You know,
failure.
it's
CHD.
yeah, it's a little challenging to not know the full sort of picture of the individual.
Yeah.
But certainly there are therapies that can help prevent progression of the kidney disease and heart disease, and SGLT2 inhibitors are important, GLP-1 important, and a medication called finerenone as well are helpful. And then there are a variety of lifestyle approaches, you know, reduce sodium and things like that that can be helpful as well.
Any thoughts, Dr. G?
I echo those sentiments.
Fantastic. Thanks so much, everyone, for joining us. And thanks for the question coming in from our YouTube channel as well. Make sure to engage with our YouTube channel. What more would you like to see in the 2027 ADA guidelines? We'll check in with those and maybe bring them on the next time we have Dr. Gabbay and Dr. Dansinger on. Don't forget to subscribe to our channel right here on YouTube, youtube.com/the way to my heart. Dr. Dansinger, yours is Michael Dansinger, MD. So make sure to subscribe to his channel. And Dr. Bob, is it Ask Dr. Bob? Is that your YouTube channel? Or that's Ask Dr. Bob is his YouTube channel. So make sure you take a moment, subscribe to all the channels for the best and most up-to-date information to help you improve your quality of life with diabetes and PAD. Thanks, guys.